Welcome to the Childhood Lead Poisoning Prevention Podcast, where we plan to explore the public health innovations that are happening across the country in our many different childhood lead poisoning prevention programs across the United States. I'm Scott Pauley, and I'll be your host today, talking with our representative from Marion County, Kristen Milbrath. Marion County has been working on an initiative known as LeadADVISOR, an AI-powered tool that translates complex lead inspection reports into plain English. Instead of wading through pages of technical jargon, parents and homebuyers in Marion County can now go to the LeadADVISOR website, type in an address, and get a clear answer. Does this home have lead hazards? Joining us is Kristen from the Marion County Public Health Department, located in Indianapolis, Indiana. Kristen, welcome to the show.
Hi, Scott. Thank you so much for having me and giving me and us the opportunity in Indianapolis, Indiana, to talk about the work we've been doing here. I love that we finally got the opportunity to discuss some of the things that we've been working on. I've personally been in the lead department for about 5 years now, and in my current role for about 4. And it's great to see how we've grown over the years and what we were able to produce within the last couple of years.
Yeah, it's incredible. You guys are doing amazing things there. Obviously, we're here highlighting one of your recent successes, but can you just tell me a little bit more about the background for your county, for your program, for your team, and just kind of what do you guys look like there? What are you guys operating out of?
Yeah, so we are actually the biggest county in Indiana. And then behind us is Lake County, Indiana, up in the northwest area near Chicago. So for us, our department there's 20 of us, and all of us have different program areas. I personally oversee our clinical staff, so I work a lot with our case managers, our lead case managers, outreach coordinators to do testing in schools, and we also work with providers where we call them report cards. And I won't get into the nitty-gritty on that one, but with it, we have another outreach coordinator that works with them to follow, how many children are going in to see this provider and how many of them are being screened for lead poisoning. So we like to look at those numbers and see where we have room for improvement, where we can increase the numbers. And my team is about 10 people, including myself. So we do a lot in the clinical side, but we also have our environmental side that goes out and does the lead inspections and completes those. And as we were talking amongst the different sides of everything, we realized there's just something missing. So that's kind of where we came up with the LeadADVISOR.
Well, let's talk more about that. So what was the problem that you guys were trying to solve, and what really led you to decide that this was the best way to go about that?
Yeah, the thing that came up first was our in-house database that we use to hold inspection reports. It's called Acela. And for us, it provides us the opportunity to be able to keep better documentation on those things, on, inspections, and track them along with other areas within the health department, such as housing, indoor air quality, hazmat, things of those nature. And we realized while we have the ability to get in there and put those reports in, there's also a public facing side of that is not accessible. That even as somebody that works at the health department, I have no idea how to get on that website on the public facing side to find already publicly available information about lead inspections. So that's where we saw the opportunity and where we saw the most need to do something so individuals can have the education and the basis to make an informed decision on where to live within the county. And, as you continue working in the same area, you see there might be several homes that have lead exposures in them that just aren't fully being abated, or things that just aren't really being taken seriously. So we were able to take that idea and run with it.
I love that. So, obviously, I think the biggest takeaway here is that you're looking at trying to make this easier for just your average parent to be able to go in and find that information. But can you tell me what does that look like functionally? Like, what is that when they come to look at the website? What does that show them?
When somebody gets on our website to look at the LeadADVISOR, it's actually housed on our Mission Unleaded website that has other very good information on it as well, where we have schools that can sign up for school lead testing, and there's different areas that you can look at depending on why you're visiting the site. Are you visiting it from a school perspective, a parent perspective? And I mean, I could go on with that. But we decided to put it on that website, where when you get on, there's a pop-up that comes up and you can start looking at the LeadADVISOR. And with that, you can type in an address. You can type in your address, a random address, and it should pull up a report for that home if there has been one done. I believe within the last 10 years. If there was an inspection that wasn't completed on the home within that 10-year time frame, or hasn't been completed at all, it'll tell you. There will be a little pop-up that comes up that says, "Oh, there's no report found." And if you have questions, feel free to reach out to us at the health department. And with that, they're able to look at the reports. And I'm a visual person, so I love the fact that there are some visuals on there. There's some graphs that can show you, okay, this is where your dust sample is, and this is the threshold, and give you that idea of where you're sitting in regards to the current levels. And it also provides you the opportunity, when you're looking through those reports, to ask questions about them. There is a chat function on there where you can ask, if you don't know what a certain term is, you see EBLL on there, or any type of acronym that we may use that you may not know, you can ask it and it'll tell you what it is.
Right, and that's got to be really helpful, especially for you, for maybe for preventing your team from having to field some of those questions that would normally come in and eat up some more of your time as well.
Yeah.
Yeah. All right. Well, can you tell me, so obviously, I think, most of us are not very tech savvy. So I'm pretty sure you did not build this yourself. So can you tell us a little bit
You
more
would be
about
correct.
exactly. I wouldn't either. So can you tell us a little bit more about how that partnership with the contractor that you worked with to build the lead bot as well, actually tell us how that kind of developed, where you kind of had that relationship built from, and how that worked.
Yeah. So when I started at the health department about 5 years ago, that was a relationship that had already been established. And, through the process of working with them and talking with other staff members here, I was able to learn a little bit more about how that relationship began. And it was, I don't know how long ago the relationship started, but we had their help with something on a very small scale. And as the years have gone on, we've actually asked more of them. And while we continue to grow, they continue to grow and give us ideas for different projects. And it's been nice to be able to have that rapport with them and to be able to grow that relationship, because they're able to take something they've already created for us and expand it. So they already have an idea of what it is we're wanting, and sometimes they know what we want before we know what we want. And they're actually in the process of helping redo all of the health department's websites. So it's been nice to see them grow as a company as well.
Yeah, and that's always great when we're working with our local, smaller business partners as well in our community. I know that's always a helpful thing for us when we're trying to pair
Yeah.
that partnership. So, yeah, I think, on top of that, the next question usually is going to be anytime we're in public health is how did you pay for this?
So we were actually very fortunate that we had recently gotten some funds, I believe through a grant, Health First Indiana possibly, and we were able to use those funds to pay for the updates to the site and creating the LeadADVISOR and all of that, which I will say in regards to the payment, it was something that we knew we were wanting to do this for a little while, so we were able to look at budgets and look at things and come up with a plan to be able to make it happen. It wasn't something that overnight we were like, let's do this. And then we looked at the budget and we just had, $50 to $80,000 just sitting there ready to go to create it. It was something that we put the thought into it and made sure we were able to have that available for us.
Yeah, I feel like that's a pretty common experience in public health is to have an idea and then figure out how to pay for it after, right? Have to
Yeah.
have that resilience.
Yeah.
Yeah. So I think we kind of talked about this previously in the conversation, but what, there was a big idea moment usually when you have something like this. And what sparked that? Like, where was the original conversations about this, and where did that happen, and where did that come out of?
Yeah. So with that, there was actually a leadership group that we were a part of. And I always call it NLAF because I can never remember the full title of it.
The
So if
National
you
Leadership
know,
Academy for Public Health, or for the public health.
yes,
Yes.
thank you. So
Yes.
that was through the CDC. And as a part of their lead-free city initiative, we got together a group of individuals from the city. Some of them were from Indiana University, Indianapolis, and some of them from the health department. And through that leadership program and talking with other cities that were also looking at lead free in the future, we were able to come up with this is what we wanted to do. And that was through a lot of conversations. There were a lot of things that, we had tried that didn't quite work out. And, I think through those no's and, the lack of feasibility or something not really being realistic, we were able to get to the LeadADVISOR. So that was like thinking back on it now, it was a tiresome process, but worth it in the end.
Yeah, I'm sure that's. I feel like maybe
Yeah.
that's also another common experience in public health, a tiresome process that is usually worth it in the end.
Yeah.
Yeah. So why don't you talk to us a little bit more about the technical side of this? What did you guys have to do in order for this to be real and to be plausible, and what did you have to deliver to your partner for them to be able to make this product?
Yeah. I think the biggest thing I can think of is advocating for ourselves to be able to make this happen. I mean, this day and age, you hear AI, a lot of people get scared, which I mean, that's fair. There are some things out there that you're like, I don't know how this works. So you get a little frightened by it. But with that, we were able to talk with the individuals and figure out what their fear or hesitancy was with it. So a lot of it had to do with public health information, personal health information becoming public. We're fortunate in Marion County that we we don't only go to homes where a child may have a lead level above the action level. We go to all sorts of locations to do lead inspections. So that piece of it was something that we didn't have to worry about, where I know some health departments, they only go to homes where there has been a confirmed child in the house with a lead level above their action level. So that was something we didn't really have to worry about. And then once we were able to explain to some of the tech people at the health department that this stuff's already publicly available, it's just not accessible. They, once they finally got that, they were like, okay, okay, I see what you're saying. Let's figure out how we can do this. And there were a lot of conversations between us at the health department and our partners at Plow Digital to figure out how we could make this happen and do it in a secure way so there was no personal health information getting out there that shouldn't be out there.
Yeah, no, it sounds amazing. And so you do have some safety, I don't know what you call them, like stops,
Yeah,
in order to prevent anybody from getting into that. Why don't you talk about some of
yeah.
that side of it?
Um, from my very basic terminology, and understanding of it is we have our servers at the health department that pull very specific data points and put those into another server. And from that server, our LeadADVISOR pulls those data. So there's kind of like a middleman, if you will, to make it a, a little easier to make sure things aren't being transmitted to the LeadADVISOR that shouldn't be transmitted. So there's several safety checks in there, and I'm sure somebody across the street could explain that way better than I could, but that's my understanding of it.
I mean, as long as you got IT and legal sign off on it, I think we're probably
Yeah,
good, right?
yeah.
Yeah, yep, that's usually what we're looking for. Okay, and so can you just tell me kind of what's the impact that you've seen so far? I mean, have you really gotten anecdotally any feedback that has really made you feel like, hey, this is something that's going to keep building and we're really excited about where this is going?
I mean, the feedback that really comes to mind is, and I guess it's not even feedback, it's more we were able to go live with this tool in 2024, and last year in 2025 we already made updates to it to include more information because it was something that continued to grow for us. While
Yeah.
there is definitely more we're going to be doing coming up regarding the marketing side of things, we actually recently created a video for doctor's offices or dentist's offices or any type of office you could probably think of that would get the word out about this specific website, especially because it's one of those places that you can ask it questions and it can go in depth as you want it or as surface level as you want it. And I think for individuals that are a little bit more versed in the lead world, digging deeper into some of the reports that they can pull is helpful. But if you're a parent that just found out your child might have, you know, lead exposure or lead poisoning, you can get on there and ask just basic questions to possibly make yourself feel a little bit better about the situation and know that there are resources out there for you.
Yeah. Okay. And so then, when we look at this, usually in a project like this, we kind of have some speed bumps or some things that maybe that didn't go perfectly. What were some of those things that maybe happened during the process that you feel like it would be great to share because if somebody else is trying to do this as well in their program, it's always great to learn from somebody else's hard bumps and
Yeah.
their hardships.
I would, yeah. We went through many iterations of this. We had a lot of testing completed where we had individuals that knew about lead look at the website before it went live. We had individuals that were community members look at it before it went live to see if it was something that made sense from a community standpoint, because at the end of the day, that was the point. It's for the community to be able to look at that information and use it for their benefit. So if we're creating something that's not doable or reasonable for them, then why are we doing it? So we went through a lot of testing and learning what we could and could not do on the site, and making sure that when people were asking the chat questions, it was coming back with correct answers, not just crazy out of the box responses that didn't make sense at all. So there was a
Yeah.
lot of that type of testing as well. And I would say going into it, as you're working through dealing with clients and just a lot of the questions that they would ask, keeping like a mental note, or having some type of document going where you can keep track of commonly asked questions or things that you would want to make sure you can put in that tool, because our AI tool is a little different than some of the other ones in that it's not pulling from the entire internet, it's pulling from what we've given it. So we've gone through and given it different resources such as information from the CDC or the EPA or HUD, places that are well established and we know have reliable, accurate information. So I don't know what a lead equivalent would be for Wikipedia, but it's not just coming from anywhere. We've taught it the information, and it's limited.
Yeah. And so another issue that happens a lot with AI that I think we talk about a lot, especially in the scientific community or public health community, is hallucinations. That AI is so eager to please you that a lot of times it just wants to give you an answer, whether it's right or not. It wants to give you an answer. So I think you guys have figured out a pretty elegant, extremely simple solution for that. Can you explain that a little bit more?
Yeah. If you ask a question and it doesn't know the answer to it, it tells you to reach out to us.
Yeah.
It gives you our contact information and it tells you. It doesn't know, instead of trying to come up with an answer that is not factual. So that's how we went about that one.
Yeah, I love that. Okay. So timeline for this one. You just tell me approximately how long did this entire process take, and if you can break down any of the steps or like phases of it, that would be awesome too.
Yeah, I would say it took approximately a year, and a lot of it included, not a lot of it, but yeah, a lot of it was just back and forth, trying to figure out how we could get the information from A to B, or what information could go from A to B. And because you have a lot of, people in the kitchen trying to make this happen, schedules kind of got in the way sometimes. But once we were able to get the right person with the right person to get the answers that everybody needed, it went much more smoothly. And so, yeah, about a year. And I'd say about half of that was more focused just on the data.
And so now, I mean, a year into using this, have you noticed a shift in the workload for your staff from answering questions at all?
Yes and no. There, there have been changes in that it is something that if we have a client calling for a lead inspection, they can more readily and make it a lot quicker to give them the information that they want and get it into their hands, because the website has the ability when you pull up that report to print it. So you can have it within minutes as opposed to days through snail mail, or if you come into the office to get it,
Yeah,
which can be helpful. And again, with some of those acronyms that we use, it's nice to be able to use the chat function for them to be able to just ask it. Um, of course, at the end of the day, we're still available for any questions if somebody has questions about something, but some of those little questions that can easily be answered through the website have cut back on some of the calls and things.
yeah, I'm sure. Okay, and so I think one of the last things I want to talk about is you kind of talked about sometimes you got to get people to buy in, right? And you're working with a couple different sides of your department, and
Mhm.
so how did you address like the people that were skeptical about whether or not the tool could be done, and how useful it would be? Like, what were some of the ways that you kind of addressed those concerns?
Yeah. The first thing we did was try to talk to them and better understand what the concern was and get as much information as we could about that to know what our next step would be in regards to talking to them and understanding what we needed to do to be able to have them have a better understanding of the tool. So I can think of one meeting that we had with some managers from our tech team at the health department, and they didn't realize that these reports were already publicly available, and we were talking to them about how they're just not accessible. And one of the managers just stops and he goes, "Hold on. So you're telling me I could get online right now and I can pull up a report about Scott's house right now and it's already there?" And we're like, "Yeah, it's hard to get to." So it's not that we're trying to pull reports that aren't out there already. They're there. They're just really, really hard to find. And once I think they understood that they were already publicly available, they were it was much easier to to continue the process from there. And that was helpful.
Yeah, yeah, that's awesome. Though. I mean, I think perseverance is always the key for things, especially in public health, is
Yeah.
continuing to reassure and sticking forward. And I think you've kind of talked about this throughout the interview. Is you even when you heard no, you kind of figured out like, hey, let's keep pushing through and finding a way to yes. And that's how you got great things done out there in Marion County. We really appreciate
Yeah.
you coming on. Is there anything else that you want to share with any of the other clips that might be watching this and trying to get some inspiration or innovation from you?
Hmm. I think my takeaway from the program and just this process was learning what other people are doing around you too. So yes, we're doing this in Marion County, but I've talked to health departments all over the country, and I can actually remember in our one group, there was a group from Puerto Rico, and they were talking about just their project was creating a surveillance system for, you know, lead testing. And sometimes you can just get so caught up in all the things you're doing that you forget all the great things you are doing. And it's kind of refreshing to see that they're able to now have that surveillance system in place and that they can continue to grow, and it doesn't just stop because you feel like you're plateauing. Um, and just kind of looking at reframing things. Just because it doesn't work one way doesn't mean it won't work another.
Absolutely. Absolutely. That's refreshing. All right. And so one last time for everyone who's listening, the website is missionunleaded.org, right?
Correct.
Missionunleaded.org. Okay. Thank you so much for sharing your journey, and thank you so much for coming on and sharing this with everyone. I know hopefully everybody will find it as helpful as I found it and as inspiring in the work that you guys are doing. It's great work out there in Indianapolis. And thank you for tuning in to the very first episode of the Childhood Lead Poisoning Prevention Program podcast.
Thank you for having me.
During this episode, you may have heard the term EBLL, or elevated blood lead level. We want to note that this is an older term that CDC no longer uses. Today, CDC relies on what's called the blood lead reference value to identify children with more lead in their blood than most. It's also important to remember that there is no known safe level of lead in a child's blood. For the most current information and guidance, please visit CDC's website at cdc.gov.